Hey everybody, welcome back to my channel. If you're just tuning in for the first time, my name is Rebecca Favry and I am a certified primal health coach and a volunteer proper human diet coach for Dr. Kim Berry. I'm also the assistant production manager for Healing Humanity, the movie that is coming out. So I am here with a very special person today, Miss Siobhan Huggins. And many of you may know her as being Dave Feldman's right-hand girl. She is also a lipedema specialist and researcher, and she's going to talk to us today about lipedema, some new research, and ketones, and what's going on there. So without further ado, Siobhan Huggins.
Hi. Yeah, so I'm not sure how much people know about me. It's always interesting to go into a new community and just like duck my head in and be like, what's up? So some kind of background is I've been on a ketogenic diet for 8 years and about 2 additional weeks past that. My anniversary just came up on the 16th of this month.
Congratulations.
Yeah, and the reason I got into ketogenic diets was actually my mom had suggested it to me because from a very young age, I had struggled with obesity. At one point, I was at 240 pounds. My waist was 10 inches larger. Lots of issues, including mental health issues. So I struggled with depression as well. And I had tried calorie restriction over and over again. And at one point, I went into her office. I was like, all prepared to like go into the calorie restriction game again. She was like, well, instead of that, I've been looking into ketogenic diets, and why don't we try it together? It's like, well, I don't know. She handed me a magazine. It's like stuff printed in like checkout aisle magazines. Not sure about that.
Like tabloid keto?
Like okay. The ones that are like, this woman lost 80 pounds in 2 weeks. Here's how kind of stuff.
Women like Women's World.
I wasn't going to name names, but yeah.
Oh, sorry. My bad.
Yeah, no worries. But I did end up looking into it online. And I was like, okay, there actually is some science behind this. This was back in 2016. But even back then, there was some like Reddit communities and stuff like that were talking about it. So I was like, okay, well, if I'm going to fail, I want to fail fast and hard. So I'm going to do this super hardcore, super strict, under 20 grams of carbs per day. And for 2 months. And by that point, I should have a feeling of whether it's going to work for me or not. And so that's what I did. And at the 2-month point, I had gone down 20 pounds, but I had lost 20 pounds with calorie restriction in the past. It's just that it wasn't possible to sustain it. And 20 pounds was like, and then I started regaining that kind of point. The big thing for me, and the reason why I decided to stick to it, is that at the 2-month point, I realized that my depression symptoms were gone completely. Not like I didn't feel a little bit better and I had a little bit more energy, like I didn't have any symptoms. And so at that point, it was like, okay, well, I guess I'm doing this forever because no matter what size I am, not being depressed is better than being depressed. And this seems to work. And so I continued. And over the course of a couple of years, I ended up losing the 80 pounds. And in 2017, so pretty early into my keto and health journey, I ended up going to Keto Fest. I was part of the staff. And I met Dave in person for the first time, Dave Feldman. And he was talking about cholesterol metabolism. And that in itself probably wouldn't have caught my attention, but he was talking about cholesterol metabolism in terms of distributed object networks and more kind of engineer type language. And I would have many conversations with my dad growing up talking about JavaScript and object-oriented programming and network and system thinking and stuff like that. And I was actually working in IT at the time. So then I was like, oh, this is something I actually understand. And this is really interesting. And the other facet of it is Dave is just an interesting person in himself. Like he's very cheerful. He's very giving hugs to everybody if they're okay with it, like all this stuff. And that was like a weird person to me. And when there's like something I can't figure out, I just get stuck on it. So in a way, I kind of got stuck on Dave. Like, I gotta figure this guy out. I want to talk to him more. I want to understand like where he's coming from, where he's going with this. And he was also bringing up topics in terms of cholesterol metabolism, like, oh yeah, maybe cholesterol has involvement in the immune system, but I don't know. And he's off focusing on this other aspect. And I'm like, if I wait for him to answer these questions, I'm going to be waiting a long time because he's busy. So I ended up reaching out to him and talking to him a lot throughout that. And then on my way back home, I was already like texting him and being like, how do I get a crash course on this cholesterol stuff? And from there, we were just chatting back and forth and back and forth and back and forth and back and forth. And it wasn't long before I was reading like textbooks on lipidology and stuff like that, trying to get up to speed. And it was the first time in my life that I had, like, I'm an obsessive type of person. Like I said, if I have questions I don't understand and it's something I want to understand, I'll just be stuck on that for a long time. And most of the time, what would happen is that someone would introduce me to something, I would get super into it, and at a certain point, I would be talking to them about it, and I'd be talking like up here, and their eyes would just be glazing over, like, you lost me. But what was exciting is that for the first time, I would be sending Dave these walls of text, like, I just read this paper, and I think this, and what do you think about it, blah, 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 blah. And he would reply back just as excited. And it was like, maybe I'm not weird, or maybe I am weird, but it doesn't matter. So
that's the important thing. You know, it's okay to be weird and it totally doesn't matter.
Yeah, I'm totally weird. I'm fine with that at this point. And I've had so much fun. So that really set me off on my research journey while I was going through my health journey at the same time. So cholesterol metabolism and related topics is how I got into looking at the immune system and insulin resistance and how those two work together, and inflammation and its purpose and all of that. And then let's see, a few years ago, 2020, I think, I did a fasting experiment where I was doing 2 weeks of water fasting, and then right on the back of it, another week of fat fasting. So only consuming fat to keep ketones high and fasting metabolism going, but supplementing energy, and kind of exploring if that would make any sort of difference, what the differences were. And I thought I could do that very easily because I looked at myself in the mirror. I had lots of fat on my body. I was like, this is going to be a cakewalk. In the past, I had done week-long fasting experiments, no problem, mostly just boring, not much to write home about. But this time, about a week in, I remember I was talking to Dave about it. I was really struggling, and I was having trouble sleeping, like having trouble getting to sleep. I was needing naps throughout the day. I was like, once I could get to sleep, I'd sleep through the night, but I would wake up still tired. My hormonal cycle got disrupted, and I was just constantly thinking about food, like especially at the end of that first week. And it was very strange, a very different experience. And ultimately what happened is I did complete the experiment, but I had posted before and during pictures on social media, like, hey, I'm doing this experiment, like, here's the changes so far, blah, blah, blah. And several different people individually reached out to me in private and said, hey, have you ever looked into lipedema? Because the pictures that you've posted have some telltale signs in terms of like the shape of my legs and where I was losing weight during the experiment. Like, I was losing several inches off of my waist, but then my arm changed like a quarter of an inch. That's weird. That doesn't usually happen. Usually you kind of lose uniformly or a little bit of disparity, but not that much. And it's not like my arms are small. Like, they're definitely big. So it was strange. And my response was basically, I don't know what that is, but I'll look into it. Sounds interesting. So I did end up looking into it. I went to PubMed. I read a bunch of different papers on it, talked to my doctor. He sent me for a referral in, I think it was May of 2021. I have it in my Twitter pin tweet so people can fact check me
Okay.
there. So I got diagnosed.
What kind of doctor did they send you to get diagnosed for that?
Yeah, she is an endocrinologist, but she specializes in lipedema. So she's published quite a few papers on it. I really like her work, which was very funny because going in, it's this manual exam and like letting her look at you all over. And during the whole process, I was like, read all your papers, love your work, I have questions. And so we were having this back and forth of like, so you described this and this paper, like, do you think this is what's happening? Like, there's this symptom. Do you think it's related to this? And so I was just picking her brain. And ultimately, what ended up happening kind of simultaneously around that same time is I connected with Catherine Seo and Leslie Keith over at the Lipedema Project. And they asked if I wanted to come to a symposium they were doing and talk about what I've learned about lipedema so far. And yeah, we started working together from there. So I've shifted away from the cholesterol stuff because Dave has that very well handled. But I've put a lot of my concentration, not all, but a lot of my concentration into lipedema. And I often have difficulties with like getting bored with topics eventually. That has not happened with lipedema yet, and I don't see that happening in the near future because there's so many layers to it. Like
it's so fascinating.
I'll like get a decent idea of what might be happening with like one part of it, but then there's like 12 other parts that are simultaneously happening. It's like, I don't like having this disease. It's very emotionally complicated, like body image, blah, 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 whatever. But it's super cool and fascinating at the same time. So
yeah. So can you give us a little bit of a rundown on sort of like what lipedema is, just in case people don't know?
Yeah, so and someone in the chat actually just asked, what are the symptoms? Perfect question. Lipedema is a lymphatic and fat disorder, so there's involvements in both. There's unusual fat growth that is disproportionate. And kind of the classic lipedema shape is that they may have a typically sized waist and torso and face, but then they have a lot of extra fat on their lower body. And it does come in different types. So it could be someone who just has really, really big hips, or it could be down to the knee or all the way down to the ankle. And sometimes the arms are involved. And when that happens, the upper arms tend to be more severe in terms of the fat growth. And another aspect of it is that it also comes with non-pitting edema. And that basically just means swelling, where when you press into the limb, it doesn't leave a pit. And with that, the way that it's experienced is often that your legs or your limbs in general may feel very tight and heavy. And you may notice that you get really, really puffy ankles. You may notice that like at the border between your foot and ankle, there's this like little curving out. It's called a cuff. It can happen at either the wrist or the ankle. Doesn't happen in everybody, but that's the result of that abnormal fat growth. So
now, can that be so slight that, let's say, like you wake up in the morning and you don't have that feeling of the tightness? Because me and you talked about this, like, because I feel this sometimes in my lower legs, but I don't see like any type of swelling, but it feels like they're swelling. But right at my ankles, it looks like there's just a little tiny bit of a blip, but it's almost not noticeable.
Yeah, so that's a really good point, because in a lot of the pictures of cuffing that you'll see, it's like super obvious, and that is not always the case.
Like they're wearing joggers. It looks like they're wearing joggers.
Yeah, exactly. Like the pants that have the little elastic cuff at the end and it cinches in. So it can range from very, very mild and subtle to kind of overlapping with the actual ankle, just depending on how much tissue there is and how much swelling is going on. So if you want a picture of the more mild forms, me and the rest of the team at the Lipedema Project, along with several different lipedema-focused clinicians and researchers and stuff, we put out a paper called the Proposed Framework for a research case definition of lipedema, something along those lines. And we actually have a picture where we grade the ankle cuffing. So it goes from no ankle cuffing, very mild, moderate to severe. And so you can kind of see an example of that earlier sign. And again, not everybody has cuffing. It just depends on where you have that tissue depositing, because if you don't have lipedema tissue in your lower legs, you're not going to see cuffing, because you know, it just depends on that. So another factor that comes in, so we have the disproportion, we have the swelling. There also tends to be pain, and painful fat in particular. So one way this might manifest is, you know, you might be getting a massage and they touch your thighs or your legs and it's painful. And it's like,
I've been there.
Yeah, that level of
that in the back of my arms.
Yeah.
And the back of my arms and the back of my, like the insides of my legs, and then and on the insides of my knees. I thought that was normal.
Yeah, and that's the thing. Like, a lot of people experience things and are just like, well, I'm experiencing this and I'm a normal person, so this must be normal. Because I've experienced this too. If my arms were super sensitive before keto, like someone would touch my arm, I'd be yanking it away. And I just thought that was normal, or maybe it was a me problem. Maybe I'm just super sensitive or exaggerating or something like that. It's really hard to get a sense of what isn't typical if nobody talks about it. Like,
exactly.
If you get your blood pressure taken or your blood taken and they put on the tourniquet on your arm and that's painful, we've seen a lot of people with lipedema who have that tissue in their arms who are having that experience, and they don't realize that might be related to having lipedema. So the pain is typically wherever the lipedema tissue is. But the good news is that, for one, not everybody experiences pain. So in some studies, it's like 60% experience pain, 30% don't. In our own community, some people don't experience pain until they do. But also, some people experience pain, but they might see that decrease or stop completely with conservative treatment. And I'll circle back to what that means in a little while. But then the other thing is, like what I experienced, when you have lipedema tissue, something that can happen within that tissue is that the fat begins to scar. And that causes probably two things. The one thing we know for sure that it does is it causes a bumpy feeling to the fat, because normally healthy fat is like,
is this like a typical spot, like right here?
Yeah. So I have some here, especially close to the armpit, on the inner thigh, back of the knee.
Rice?
Yeah, like uncooked grains
like
of
little
rice.
grains of rice.
Yep, uncooked grains of rice. Sometimes the nodules could get bigger. So it may be up to like walnut size, plum size, even apple size. Like they can get really, really big, but very firm, like little bits in the tissue. And then along with that, typically what people also find is that the tissue is overall very loose. So I always compare it to like a pork chop, like room temperature pork chop, like poking at the fat. It's smooth, it's firm, it's got like a nice amount of springiness to it. And that is fat, like that's healthy fat tissue on a pig, not a human, but it's a point of reference. And with lipedema, we find that it's very loose, like it can pull and stretch almost like dough. And sometimes it can feel, especially closer to...
I'm trying to think, like, because we're all hypermobile too. So it's like, I'm just wondering if it's like, is that what you're talking about?
Yeah, so the stretchiness of the skin, but then also the tissue in general, like it hangs down. It's not like up close to the body. And the fat tissue itself also has that like looseness to it. And then also closer to the bone and muscle, there can be a sponginess, particularly in the legs and ankles. So in terms of sponginess, like let's say you took a water-soaked sponge and you slapped it against your leg, and then you're feeling your leg through that sponge. So if you did that, you would have difficulty feeling the underlying muscle structure. the underlying tendons and like the underlying tissue beneath. And we find that with lipedema too, and that is caused by, we suspect, bound fluid that's in the tissue. So basically fluid that's bound itself up into proteins, and then it causes like this spongy texture in the tissue because it's bound up. So
okay.
So to recap.
Okay, go ahead. Yep.
Yeah. Oh, and the second thing that the scarring does that's important to mention is exactly like what I experienced. When people with lipedema lose weight, they may find that they can indeed lose fat off of their waist, off of their torso, off of their neck and their face, potentially off of their arms if they don't have lipedema tissue there. But then they find that that weight loss is disproportionate. So their legs may change a very small amount or not at all, even if they've lost a lot of weight. And I would suspect that is because there is scar tissue within the fat, and that's just not going to respond like normal tissue.
Interesting.
So,
now, you had mentioned to me that there's also maybe a new presentation that you're starting to see. And I wanted to see if you would talk about that just a little bit, because it kind of is almost an opposite.
Yeah. So
to what the typical, it's like almost an atypical presentation. I think that's what you called it, atypical.
Yeah. And I don't know if this is a real thing or if I'm just imagining things. But I have seen a couple people where their legs, even like their hips and things like that, look typical. So they have muscle definition, they don't have any cuffing, it doesn't seem like they have loose tissue, and maybe they have like some nodules in the legs, but comparatively there's just a lot less tissue. But then in their abdomen, especially their lower abdomen, their upper arms, they have the bumpy tissue, they have the looseness, they have the excess fat tissue, and they experience swelling in their abdomen. And sometimes they can have the other lipedema symptoms like the pain and things like that. I don't know what it is. And I don't know. It's a pattern I've seen maybe 3 or 4 times. And sometimes with these people, they display like breathlessness. They might have more swelling after exercise. Swelling into the abdomen, like I mentioned, low appetite, nausea after eating, digestive difficulties. And I wonder if it's actually more similar to what Leslie and Keith has been focusing a lot on, which is central lymphatic dysfunction. And what that means is that, so your lymphatics empty out back into your bloodstream. So all of the excess fluid, all of the large proteins, exit back into the bloodstream from the tissues through the thoracic duct. And we have seen in some people that that flow can be disrupted. I know one person where they have loads of swelling all over their body, but particularly centrally, and they actually have a lymphatic issues from birth. So they're missing lymph nodes. They have like twisty lymphatic vessels, and the thoracic duct is actually gnarled, meaning it's more like a corkscrew instead of straight on. And you can imagine that would mess with emptying back out into the bloodstream. There's another person that I know of that actually had debris blocking her lymphatic duct. And she ended up bypassing that into her carotid. So they bypassed her thoracic duct so her lymphatics don't empty into her carotid artery instead, to bypass that blockage.
That one blockage, yeah, okay.
Yeah.
Did it help?
It did help for a while. She still has difficulties. And that's the thing with central lymphatic issues. If that's what this pattern is it's people potentially with, and it can range, it seems like, from what we've seen, from very, very mild up into like blockages and defects in the actual structure. So it's a wide spectrum. But it is something that Leslie and Keith has been looking into, and I'm wondering if this atypical presentation is just something to do with that. Because Leslie has talked about things like in people with prior obesity or pregnancy, like just the growth of fat and the growth of the tissue and the pressure that that can put on things, and then the loose skin afterwards may result in difficulty draining lymphatic fluid. Like for myself, I have loose skin in my lower abdomen, and I find it really helpful to use kinesiotaping to lift that and shove it back into place to make sure there's a proper amount of pressure, because what should happen when fluid enters tissue is that the tissue is nice and elastic, the fluid enters, pressure builds because of that elasticity pushing back on it, and that pressure will push it towards lymphatic vessels and then out. And it seems like with the loose skin that I have, that's not happening properly. And so it sits there, and that may cause other issues down the line. So I have no idea. It's the pattern that I've noticed, and I like to point out patterns because sometimes it's useful. Yep. It could be nothing. It could be total coincidence. I'll straight up admit that now, but I'm putting it out there because
I think it's going to show up that it's going to be something. I think that we're going to see that there's at least some sort of a connection, a genetic predisposition, maybe.
Yeah. Maybe.
I would like to see how many people who have had large pregnancies where, and see how many of those end up with something like that, who have carried multiples, because you've got so much in there blocking things. Something could have got permanently stuck and blocked, and you just never know.
And it may be that for some people like me, the abdominal taping and then the lymphatic sessions that I do for lipedema and swelling in general, the parent technique, which focuses on getting things centrally moving. Perry Nicholson has a thing of the big 6 that's targeting like 6 main lymphatic areas and stimulating them to get the flow going. And maybe for people with really mild symptoms, those might be enough and they might be fine. That's been the case for me. And for others, they may need, like the person I mentioned, surgical intervention or other things. But the lymphatics in general are not discussed very much. And central lymphatics, it's like, what's a central lymphatic? What does that mean? So,
if you've had anatomy classes, we know.
Well, you would be surprised. Like even in the low carb community, I almost never see the lymphatics mentioned. And because the lymphatics
are so important.
They're important for digestion. They're important for the immune system. They're important for not swelling. They're important for so many things. And I want lymphatics to be like on everybody's word of the day calendar, and they integrate it and they understand what it is and what it's for, because I feel like every single doctor should know what the lymphatic system is, for one, but then also the signs of lymphatic dysfunction, not only in terms of lipedema and lymphedema, but also even milder forms. Even if it's just like, oh, it seems like you're having these symptoms, I'm going to refer you to a lymphatic specialist so you can follow that up. Like referring out, completely fine. And then Roxana asked, is more swelling in the morning a telltale sign? I don't know. With lipedema, typically what happens is the swelling goes down overnight and then gets worse over the course of the day, particularly with long periods of standing. With central lymphatic issues, maybe it's different. I would recommend, I'm going to pitch this to you right now, have Leslyn on and then ask her all about central lymphatics, because she's like the expert. I just listen to what she says and then repeat it.
Okay. I've got an email out to her, so we'll see if she gets back to me. I know she's really busy. So. Yeah. So what's the new research then that's really coming on for lipedema? Do you have anything going on right now with lipedema?
Yeah, so we have a couple different things. Number one is at COSI, the Collaborative Science Conference. I presented a citizen science project that we did with the community, which is super exciting.
Watching.
Oh, hey, Leslyn. Yeah, I was talking about central lymphatic dysfunction and this kind of inwards out profile that I've seen a couple times, and I'm wondering if it's maybe related. So I'm hoping you'll come on and talk all about it and what the symptoms are and how to recognize it and who to reach out to if you suspect that sounds like you. But yeah, so yeah, awesome. COSI. So through the Lipedema Project, we did a citizen science project, which I'm a huge fan of, as long as it's done safe, sane, like have a buddy system, talk to your doctor. But we had seen in the community a couple times that people were using exogenous ketones, and some people said that it helped with pain. Some people said it helped with fatigue, but there weren't any studies on it, and studies take a long time. And it's like, okay, maybe we could just explore this as a community and see, like, is this something where there should be a study on it? Because in some cases, like, people are like, oh yeah, I use this, and then a group of people use it where there's a study done on it, and it's like, oh, actually that wasn't that impactful. And so we got 9 people together, and they agreed to take exogenous ketones for, I want to say it was 3 weeks. The presentation will be coming out on YouTube hopefully soon.
Yay.
Information staying in my brain, it tends to leak out, usually onto other people. So we had 9 people taking these exogenous ketones, and then we had kind of an intro and orientation talking about like what the project was for, what we were kind of looking at, and the principles of citizen science that we were hoping people would follow. So that kind of goes along the lines of safety first. So if anything feels off or wrong, don't hesitate to stop. Have your doctor informed on what you're doing. Report everything, whether good, bad, or nothing happened. It's all good information, because we're just trying to explore this and see if it's something that could be useful for the community. And if that answer is no, then people need to know that. So we talked about all that stuff, and then we did weekly check-ins over Zoom, and then weekly surveys that people were filling out on pain and cognition and fatigue. People at those meetings introduced a whole bunch of stuff that we were like, wait. So one of the things was one of the participants saw this big increase in appetite. Like an hour after taking the exogenous ketones, she'd have this big increase in appetite. And she ultimately ended up changing her diet to be very, very high fat, like carnivore adjacent. And she found that she was experiencing satiation for the first time, and hunger for her had actually been very unusual. So she had a long dieting history. And she said she just didn't get hungry, like ever. She would eat because it was time to eat, and she'd be done because it was time to be done. But she wasn't experiencing that typical increase in hunger cues. Yeah, the hunger cues. And for some reason, the exogenous ketones seem to change that. And interestingly, you might think like, okay, she's eating higher fat. She's probably eating like more than typical. She's getting hungry, so she's probably eating more. She must have gained weight. She must have gained inches, but it was actually the opposite. So her inches actually decreased over the course of the experiment. And there were several other people who also found that their measurements went down taking the exogenous ketones. Why? No clue. But that was not something I expected. Yeah. But the big thing, so we did have one dropout. She actually had central lymphatic dysfunction. And she found that the ketones made her really nauseous, and she actually vomited at one point, and she's like, I'm done. And we were like, yeah, you're done. No more. So she did drop out. So that's worth mentioning.
Now, question, did you guys use like a specific one? I don't mean brand, so you don't have to name drop brands, but was there like a specific form? Was it like the salts? Was it the esters?
So what it was, and I'll mention the brand because they did provide product for the experiment, and it's good to disclose that. So the one that we used was original ketone, and it's actually a bioidentical. So it's not a salt, it's not an ester, it's just straight up ketones, and they're available immediately. And they actually had a safety and efficacy study that they had published. So, and they wanted to work with us. So it's like, okay. So they provided product for the entire experiment. They donated towards that project. So that was really cool to because it's kind of like collaborative science. It's cool that we got to present there because it very was like a company who wanted to work with individuals who wanted to just figure out, like, is this worth exploring? But the main thing is that the people in the experiment who had pain at baseline pretty much universally saw decreases in pain when taking the exogenous ketones, which is super interesting. I have like...
Well, there's been a lot of studies done. I mean, now, you listen to Ben Bickman, he talks about this. He talks about the anti-inflammatory effects of ketones. So it makes you wonder if it's because there's an anti-inflammatory effect to them, or is it
maybe
something
else?
Well,
so ketones are interesting, and I don't like the term anti-inflammatory because it's like, well, is it inhibiting inflammatory signaling, or is it disrupting what was necessitating the inflammation in the first place? That's a question that we always have to ask, because if ketones are anti-inflammatory, like let's say someone's on a ketogenic diet and they get sick, like in that case, we need inflammation. And I've seen this question come up before of like, well, if I'm on a ketogenic diet, is that bad? Should I go off of it when I get sick or when I break a bone or something, because ketones are anti-inflammatory? Well, right. But like if we're inhibiting inflammation when we need it, that's not good. So instead, I tend to think of it as non-inflammatory and potentially inflammation regulation, which is fun to say, but also is more to say like it may be helping with things that may be causing inflammation and thus pain. And maybe they are anti-inflammatory in some circumstances, but Amber Hearn, who's another researcher in this space, she mentioned to me how there's a study showing that in certain circumstances, during certain types of, I think, viral infection, ketones can actually enhance inflammation. So they may actually help with a very strong initial immune response, which is really good, because if you can do that, you can sometimes take care of the infection and then move on relatively unscathed. So with ketones, it seems like, oh, hi, Heidi. So it seems like there is a level of context involved of, is it anti-inflammatory? Is it just non-inflammatory? Is it resolving issues that were there? And in some cases, is it pro-inflammatory, but in a good way? So yeah, ketones are cool and complicated. But in this case,
they really are, but it's super interesting because our bodies absolutely have the ability to make them. So we've got this built-in little like mechanism that does a lot of really cool things in the body.
Yeah, the list of things that ketones do is profound.
Absolutely.
But with lipedema, one thing that might be coming into play is there are other things in the research that talk about how with interventions that decrease swelling with lipedema, it also tends to decrease pain. So two factors with that on ketones. One is in mice, rats that have become obese and their fat tissue has become fibrotic. If they get their ketones up high enough, 3 millimoles, which is really high for a rat. It's either 2 millimoles or 3 millimoles. I have it in a presentation somewhere. But it actually helped reverse that fibrosis of the fat. So that in itself may help with lymphatic flow if the fibrosis is compressing lymphatic vessels. Maybe that would explain why some of these women saw their inches decrease if they suddenly had access to that fat again. I'm just throwing things out there, like somebody please research.
There's so many. It just seems like we need so much more research. And I know that the D'Agostinos in Florida, they are doing so many research studies. Now, granted, a good chunk of those research studies are done for the United States military.
For sure.
And for the Navy SEALs, from what I heard in one of his presentations, I'm like,
which is awesome.
It is. However, there's more other people than Navy SEALs in the world. Just saying, we need generalized studies too.
Yeah. But the thing is, like, and not to dismiss that point, but sometimes, like, if you can target an audience that has a lot of money that they can spend. You can use that money to get things for the general population. So sometimes that can be a way to do it. But then another aspect of ketones, also in mice. So for both of these things, we don't know if they work for humans. We would need actual like human research on it. But in mice, it seems like ketone exposure can stimulate lymphatic vessel growth. So maybe that's another aspect. One thing I would also like to see, which shouldn't be difficult, is there's this dye that you can inject called ICG. And it's a green dye where it gets taken up by the lymphatic vessels. So you can see fluid moving through the lymphatic vessels when it's injected. Now, what I want, and Heidi, if you're still listening, what I want is for someone to take the ICG, inject it. It's supposed to be really, really painful, but I would do it anyway. And then take exogenous ketones and see if it causes lymphatic vessel contraction, because that would help decrease swelling.
Interesting.
And one of the other things that we saw was some of the women in our citizen science project said that they felt like they were swelling less. And I actually wonder if for the central lymphatic person, and again, I'm throwing things out there, but one thing I've noticed is when I swell into my abdomen, it can make me nauseous. And I wonder if the ketones were decreasing swelling in her, but it was shifting that fluid centrally and making her nauseous that way. So it was decreased swelling, but then she couldn't move it all the way out, and it was causing nausea. I have no idea. I just think about things.
Interesting. Well, it made me think about something because, you know, we always hear like that there are just certain things. Now, this is the nurse side of me talking right now. So there's certain things that like you just don't see things regrow, right? And then, you know, when I first came into nursing, it was like the pancreas doesn't regenerate, the kidneys don't regenerate, the heart doesn't regenerate. The only thing that regenerates is the liver. Well, now we're finding out that that's not true.
Yeah, I mean, in heart disease, you can have collateral vessel growth.
Regrow.
Yeah, yes, you can have collateral vessel regrowth.
Are ketones being involved in that? Because the heart is super like ketone sensitive.
Yeah, for sure. Yeah, and like here's the other thing is typically, and this is just talking about injury in general, like usually there's damage and then there's the immediate inflammatory response. You clean up the debris, all of that good stuff, and then you do repair. But what happens if you are stuck in this zone? And I've seen Dave talk about this too. You're stuck in this zone of that emergency response of damage, there's damage, insulin is high, that's part of the immune response, that's part of the inflammatory response in certain situations, and you have to move out of that, like people with chronic hyperinsulinemia. So what's interesting about lymphatic vessels is there's existing research showing that I think it's a type of hypoxia-inducible factor, which all that means is there's a type of signal, but that type of signal can be decreased during certain inflammatory signals. And that signal that is being decreased from those inflammatory signals is needed for proper lymphatic vessel regrowth. So if someone is in a chronic inflammatory state and they don't have ketone exposure, I can see that being a situation where there may not be as good, as proper, as effective lymphatic vessel regrowth. And maybe that can happen with other tissue structures as well, where you just, if you can't get into that low insulin, low inflammation, really good repair spot, maybe that just doesn't happen as effectively. But I don't know. I'm happy to say I don't know pretty much everything because I don't know.
So I have a question for you about the ketones, and this is just anecdotal. I heard somebody talk about this, that other forms of ketone. Now, I don't know what, like, I haven't looked at the original ketone, so I'm going to go research it. I might try it because I do supplement. I supplement with an ester because that's what I can afford. Like, salts are cheapest. Esters are next, and they taste like jet fuel. They really do taste like jet fuel. Sorry, but they do. So I've heard that there's some research out there that esters and salts have been causing liver damage in mice. Have you heard that?
I have not heard that, actually. So if you have links to studies, I'd be happy to read that. But
I do not. The person that told me owns a company, and they're involved in research.
Mm-hmm.
And they said they didn't want to put this out to the public. And I'm like, well, if you're not putting this out to the public, you probably should be.
Yeah,
if it's damaging livers. So I just wanted to see if it had actually, come across your desk.
Yeah, not
your
mine.
Feed.
But okay, so first thing is mice aren't people. Like humans, the wondrousness of humans, and this isn't to dismiss that either, because if they're seeing that in mice, let's take a look at humans supplementing these salts and esters and see if we see the same thing, because that's good information to have if that's happening. But like humans are wondrous in that we're highly ketogenic animals in almost it's not super common. It's not as common as you might think. Like dolphins, they eat fat and protein, don't eat a lot of glucose, but do they produce ketones? Not really. Do they run their brains? No. So Amber O'Hearn has done a lot looking at ketogenesis in different animals. And humans are very fat loving, and we are evolved in a way where we are very, very ketogenic, even under adequate calorie and adequate protein circumstances. Even high protein circumstances, people can still have 0.7 ketones. Rats are not like that. And a lot of animals aren't like that. Dogs can be a little bit ketogenic. And migrating birds is another one that she brought up. They're ketogenic, but a lot of animals aren't. Dolphins aren't. I don't think hibernating bears are. Lions aren't. So if you want to call it a lion diet, I'm sorry, but that's not a ketogenic diet in actual lions. It is in humans because we're special, but in lions, what actually happens is they convert the protein into glucose, and that's what they run their brain on, but they are not ketogenic. A lot of carnivores aren't. Domestic cats, not ketogenic. You should not be fasting them. It causes liver damage, actually, fatty liver.
Yeah.
So with mice, they can be ketogenic, but it's important to note that they're not really built to be ketogenic to the levels that humans are. And in order to even get them to be ketogenic, and this is talking about I think 0.3, 0.4, you have to either calorie restrict them or protein restrict them. Like if you talk to researchers who've worked with trying to get mice to be on a ketogenic diet, it is a razor thin wire where you have to do one of those two things. And with humans, we don't have to do that. We don't have to calorie restrict, and we don't have to protein restrict. Some people benefit from adequate protein instead of high protein, and they get higher ketones with that. But even for the people who are on 30% protein diets, there's no way a rat could be ketogenic on a 30% protein diet, even if it was zero carb. So maybe that's one issue of it, is they're just not really built to deal with the level of ketones that they're getting with supplementation. But maybe there actually is an issue with ketone supplementation or with the salts and esters specifically. Maybe there's something specific in there that's could be changed and updated. I don't know. But I do think it's worth looking further into to see exactly what is causing the issue, and then see if we see that in humans, and then why not also throw in bioidenticals and see if they show similar issues in rats and in humans. That might help narrow it down. But with anything in rats and ketogenic diets or anything like that, you always have to be aware of the pros and cons of the tool that you're using. It's like epidemiology. It's not that epidemiology studies are bad. It's just that they have a specific purpose, and we can't, we have to understand the limitations of that tool. So I want to see further study on what you're talking about, and further study in humans, because that's going to be the most relevant. And like, I guarantee there are people who are supplementing exogenous ketones and would be happy to do some sort of testing to see, like, do they show elevated liver enzymes? Do they show any cyto damage? Do they show fatty liver of any sort? Or
well, the thing of it is that like in Dr. Barry's community, like we've had a whole crap ton of people like be like, I've reversed my fatty liver. If it was, but now they aren't supplementing.
Yeah,
this is endogenous versus exogenous. So,
and if that is an issue, then we do need to figure that out. We need to know specific forms, or is it supplementing in general? Because we don't want people doing things that are going to make them sick. But it does need to be clarified where the actual issue is, and is it because rats' metabolism aren't set up to process them correctly, or whatever's happening.
I'll see if I can find this person's research, because I'm not going to name drop.
Yeah, of course.
So, I might tell you afterwards, but
sure. Cone of silence.
But not to the public.
Yeah.
So I had a question, and this came up, and now this is going to circle back. Sorry, to lipedema. And have you guys seen any studies with low dose naltrexone and lipedema?
I don't know what that is, so I have not. But what is it, and what's the method of effect, I guess?
Well, the method of effect right now that they're looking at is they don't know 100% how it works.
Okay, that's always good. It makes it interesting.
It does make it interesting. So a low-dose naltrexone. Now, naltrexone is a drug that was used for opiate abuse.
Okay.
You give it in a super high dose, and it binds to the opiate receptors. So if somebody goes up and shoots heroin or pops a bunch of Vicodin, it's not going to do anything to them because of the receptors are already taken.
Okay, so similar to like Suboxone then.
Similar, very similar, but yeah, very similar. But they noted that people who were taking it were having decreases in systemic inflammation, autoimmune diseases or disorders, like their symptoms were starting to abate. And they were like, this is interesting. So they did a bunch of studies, and people, now they do it in very low doses. So I think naltrexone, if you give it for, I should know this, I just got out of pharmacology. If you give it for opiate abuse, it's like 300 milligrams. And the dosage starts at right around 1.5 milligrams daily for autoimmune issues. And they're starting to show that it's anti-inflammatory. And one of the theories is that it binds to the opiate receptors, which then triggers endorphin release. And then the endorphins go out and do the,
okay, yeah, see, Leslie knows more than I do.
One paper shows patients with lipedema using naltrexone if they also were diagnosed with fibromyalgia. Would that make sense? That does make sense.
Yeah.
I've seen it. It's being used now for Hashimoto's, because I have Hashimoto's. I'm on it. I got my C-reactive protein down to like normal levels, which is like kind of unheard of in people with autoimmune diseases. So I just didn't know if it was possible that using it for lipedema and for the swelling and inflammation, if that was something that had been seen. I wonder if it works on people on the lipedema also, and not just the fibromyalgia symptoms.
Yeah, maybe. I think that would be worthy of follow-up. Like I mentioned, my hesitancy with anti-inflammatory things is like in lipedema, let's say that just hypothetically there's tissue damage. That would explain the pain. It would explain the scarring. It would explain a lot of things. But let's say you now inhibit inflammation, but you haven't actually addressed what's causing the tissue damage. And my question would be, what are the long-term effects of that? Because inflammation is part of the wound healing response, the immune response too. So if you're taking anti-inflammatories, it can also have immune system effects and ability to deal with things like that, that strong inflammatory response to infection. So what are the long-term effects? What does it look like 2 years out, 5 years out? And I know with like any drug that's asking like the impossible, but it's a question that immediately comes to mind of if we're masking symptoms or interfering with how the immune system works, what if it was doing something with a purpose, like trying to address an underlying issue, and we've now inhibited it? We've inhibited its function. So I am not like completely, don't ever take anti-inflammatories, because I don't tell people what to do anyway. But if it's for like quality of life, like let's say you're someone with lipedema, and you are implementing change that you think is going to decrease pain, or this could be with anything, like you have joint pain and you're going through physical therapy, whatever it is, but you expect there's going to be like a gap of time where that's going to kick in, taking pain relievers so you can actually get up and do the work, so you can go to physical therapy, so that you can more easily implement the longer term change, makes sense to me. And sometimes like you can implement lifestyle change and it doesn't fix everything. Like you may still have lingering issues, and it's like, well, for my own quality of life, I am gonna take this, and I understand there may be a trade-off involved, but for me it's worth it. And like we have some people with lipedema who have implemented lifestyle change or are working on implementing it. They still have some pain, and they'll use something like CBD. And I would much prefer they use something like CBD rather than like an NSAID or something like that, that could cause other issues. So
the NSAIDs, the NSAIDs and like and Tylenol, like those all target a specific pathway. They just don't right now. I'm sure that somebody somewhere knows, but it's not super known, at least not what we were taught in school. I'll have to go actually do more extensive research. But they don't know exactly what it's doing. It's not necessary. I say anti-inflammatory, and it's kind of a misnomer. Just like you said, you don't like the words, anti-inflammatory. It's just that it calms down systemic inflammation, making people see reactive proteins go from 65 to 1.79, which is
and it could be that it has that effect through really helpful measures. Like just as one example I could think of, let's say it increased lymphatic efficiency. So it increased lymphatic pumping in a way that was totally cool with the lymphatic system, didn't cause anything else. That could potentially reduce inflammation by increasing the clearing out of debris, of clearing out of inflammatory cytokines. Maybe that would be completely fine. So with anything where it's like, whoa, this seems to be helping, next step is why? What is it doing? Let's figure that out. And if it's something like, that's also why I wanted to look further into ketones, because if we could figure out why it was working, we can come up with other ways of doing the same thing. But then also, like, if ketones are safe long term, then that's a good tool to have. So if the naltrexone that you're talking about is safe long term, and it works in ways that are completely compatible with healthy functioning and not interfering with things, I say hooray. But like, I'm always just curious.
I don't like
about how things
big
work.
pharma either. I don't like big pharma either, but like sometimes you can't carnivore harder. For sure. So it's like sometimes like you kind of have to acquiesce. And this was like my big pharma like compromise, like was trying that to see if it worked. But it did bring down systemic inflammation, which from an overactive immune system. I'm still working on the antibodies thing. It hasn't done it. So somebody has a question too. Somebody has a question. And Miss Amy was like, she wanted me to try to postpone it because she's like, I need to ask my question. Tell Siobhan you have to move it. I was like, I'm not telling Siobhan I'm moving it.
Oh, I'll just talk for hours anyway, so it's fine.
Oh, yeah. So Miss Amy, she is in Dr. Berry's community with us. She also has written a couple of carnivore books for kids, and they're on Amazon, and they're really cool. And Bonnie and Beckett and Granny Berry star in the new one. So she says that she has Ehlers-Danlos, classical type with lipedema, but as I'm losing, I'm seeing some of my legs getting smaller, but not by much. But they also look flat when laying down. I have it in my arms and stomach and bottom. Is there hope that I will lose in all of those areas? And she says she forgot to say that she's carnivore and has lost 40 pounds since January the 20th.
Mm-hmm. So my answer is not going to be very satisfying because I think it depends on the person and what is actually going on in their tissue. Because you could be someone with lipedema who has excess fat tissue that is not scarred. And so it could be relatively healthy fat tissue. And like I've seen some of these people in the community where they have a very classical looking lipedema body type, and they would describe themselves the same way. So I'm not putting descriptions on them. But then they go keto, they go carnivore, they seem to have caught it early enough, their tissue's healthy enough that now they may have like a little bit of disproportion, but it's really not that noticeable. And there are other people where the quality of the tissue has degraded enough to where they may lose some, especially with ketogenic or carnivorous diets, but they may still have a level of noticeable disproportion. Like my arms, like I've been on a ketogenic diet for 8 years. Like I said, my arms are still big. They haven't really changed that much. But I also find that sometimes it's not all related to diet. So like I mentioned, I'm seeing a lymphatic therapist. We're working on breaking up the fibrosis, restoring some of that good lymphatic flow and microcirculatory flow in my legs, and they're improving. And this is going to be the second year out of working with her. And I did take a couple months break, which I do recommend if you're doing more intensive work like that. But we're still seeing small changes. Like my cuffing is decreasing a little bit. My ankles are getting less puffy. Some of the bound fluid is going away. Do I know how far that's going to go and like how much my legs are going to normalize? I have no idea. But I do know that it's helping, and it's also helped with like I don't get as much calf swelling anymore unless it's like from the heat. And like my legs feel much better. I don't get that muscle fatigue when I'm going upstairs anymore because they've got some nice flow going on. They're much happier. So in short, I don't know. It depends on where your body is at and what's going on and what carnivore is doing for you and how it's going to respond. Like we don't have a way to look at anybody and then say, this is what you're going to look like after keto or carnivore or lymphatic therapy or any amount of stuff. Like we just don't know. But like the thing that I like to focus on is, you know, is this going to help my mobility long-term? Is it going to help how my legs feel long-term? Is it going to help keep my pain down, absolute minimum or close to no pain at this point? Is it going to prevent progression so that all of those things stay in place? And it's complicated because we don't have like answers for everybody of how they're going to respond. But what we do know is that in the community and for ketogenic diets specifically, there are around a dozen different studies showing that it does decrease pain. It can decrease limb circumference, hip circumference, definitely waist circumference in people with lipedema. And lots of people report less swelling, less redness in their legs, like their legs just look less inflamed. Some people find it much easier to manage the symptoms with proper nutrition. So we do know that much. But in terms of the aesthetic changes, there's not a way to predict it at this moment.
Do we know what causes lipedema, or is it something that is more like a theory, or is it related to certain genetic conditions? What are we looking at in terms of like like I say etiology, but that's like words.
Yeah, like where's it coming from and why is it happening? Yeah. So we don't know. There are some theories. I have my own thoughts on it. It's like a hour or two long explanation in itself. I've gone through it a few times with people. But there are some ideas. It may be a connective tissue disorder similar to Ehlers-Danlos syndrome, which would kind of make sense. Subcutaneous fat tissue. So the fat that's underneath your skin where we see lipedema tissue happening is a type of connective tissue. Fat in itself is a type of connective tissue. But there's also connective tissue in that fat, so maybe something is going on there. I believe Karen Herbst is of the same opinion that it might be a connective tissue disorder of some sort. I know that Ben Bickman has looked into it, and he said it's probably...
I was going to ask you what you feel about his collagen theory.
So I think of it the same way I think of inflammation, which is I don't personally believe that the evidence supports that it's just overactive myofibroblasts producing too much collagen. I think it more so lends to there might be tissue damage, and then we get scarring of the tissue because there's tissue damage. I do agree it doesn't seem likely, to me at least, like it's not intuitive to me that it would be an actual fat cell problem. Like it just doesn't make a lot of sense to me how that would work, although it's possible. But more that there's something wrong in the fat tissue for sure, but that it may have, like there are multiple components to fat tissue. So yeah, I think the scarring is happening for a reason, and it's not just overactive production. Because, okay, thought experiment time. What if that were true, right? But then someone goes on a ketogenic diet and they find that their progression has halted, which we have seen in the community before. So they're no longer gaining fat. They're not swelling as much. They remain the same weight, same size for years on end. How would that fit with myofibroblasts overproducing collagen for any reason?
I can see your point.
Yeah. So
because it wouldn't be like if it was a disorder of the fibroblasts, then it would continue no matter what, unless the ketones themselves were stopping the process.
But it's not just ketones, because even with low carb, where like even moderate carb, there's like a dose dependent. There's not really evidence to say it's dose dependent. There's not enough evidence, but we can see improvement with reducing carbs down to moderate carb, down to low carb, and down to ketogenic. So, but the most improvement is through ketogenic, but all of them see improvement. And not everybody needs a ketogenic diet to manage their lipedema. Some people might find that just switching to whole food, no processed food, no like, and
just getting rid of the junk.
Yeah, and then dealing with whatever food sensitivities they have, they do absolutely fine with that. So I don't think there's like you could say ketones help, but they're clearly not the only thing that's helping. So like this is the way I approach everything, which is okay, but then why would ketogenic diets help? Like, why is that?
Interesting. There's so many research possibilities for the ketogenic diet that we still haven't even touched.
We haven't what I haven't seen?
Touched them.
I have not seen a paper or a case series or a case study. I was thinking about this earlier. Have not seen one on either ketogenic diets or carnivorous diets on autoimmune disease. I have not seen a single one. Why is that? Where is it?
Not one case study?
Not that I'm aware of. Maybe they exist, but I haven't seen it.
I've seen... interesting because you've got Dr. Baker's group, Revero, and but he hasn't fully opened up. There's still thousands on the wait list, there's like 10,000 on the wait list or something ridiculous. Did they start accept an autoimmune? Are you?
I'm not sure.
Are you? I know that was the next group, like people who had signed up for Revero for autoimmune. That was the next group that was going to be opened up to. We're going to get a lot of information out of that whenever he starts. But Dr. Tanky has seen it though.
I know lots of different physicians who've seen it. I just haven't seen publications on it. And this is true of a lot of different things. And the issue is, and I'm not placing the blame on them, because even just writing up a case study takes a lot of time that most people don't have. And like collecting up the information and putting together a case series and publishing that takes a lot of time and effort and skill that a lot of people don't have. Like it's a whole, you have to understand the formatting, you have to understand the publication standards, you have to make sure you have all the data compiled, all of this stuff. So it's difficult, especially for a doctor that's working 12, 14 hours a day, which a lot of them are. So the fact that Tro's team, Dr. Tro, is putting out these publications, like even he's talked about how much time and effort and how they have to have like people working on that. But I'm just saying, if there are any practitioners out there who have seen improvements in any autoimmune disease, because let's say they go under an umbrella, I think that makes sense. Any improvement, any remission in autoimmune disease from any dietary protocol. I don't care if it's paleo, if it's a whole food diet, if it's Twinkies like and Lucky Charms, carnivore, whatever it is. Any indication that autoimmune disease can improve or go into remission from nutrition. Okay, so, the effect of ketogenic diet on inflammatory arthritis and cardiovascular health and rheumatic conditions, a mini review. So we have something.
We have something.
I'm going to have to, I'm going to look that up.
Copy that, paste that into a browser, and make sure, I always do this. I don't care if it's the exact title. At the end of that sucker, I'm putting scholarly. Every time. Because if you just Google, sometimes you'll find all the other crap that's connected to it, but not the actual scholarly article. Leslyn, is that on like PubMed, or is that like the National Institute?
Yep, it's on PubMed. I'm looking at it right now. So they're seeing improvements in symptoms, reducing disease symptoms, possibly through production of BHB, which is ketones. Psoriatic
beta hydroxybutyrate. BHB is so much easier to say.
Yeah, beta hydroxybutyrate.
Google Scholar. I love Google Scholar.
Okay, and it talks about arthritis, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. Nice. Yeah, so it talks about improvement in symptoms. But still, if any doctor sees improvement or remission, complete remission, because I've seen pictures of people posting themselves before and after a carnivore diet with their psoriasis completely
gone. Oh my gosh, it's amazing.
Yeah, like anything like that. Technically, there is a case study about a lean mass hyperresponder using a ketogenic diet for ulcerative colitis. So that is something, but we just need more of them. Like any type of autoimmune disease.
That's Nick Norwood's, wasn't it, Nick?
I think he was an author. I don't know.
Well,
I know he also does.
He was on palliative care. A lot of people don't know this, but I remember hearing his story. When he was at Oxford, he was on palliative care for his irritable bowel disease. Whatever it was, I don't know if it was UC or whether it was Crohn's. Whatever it was, he was on palliative care. And went on a ketogenic diet, and now look at him. Now he's only one of the most famous researchers ever.
But I'm just saying,
at
like
the young, ripe age of 28.
Yeah, any physician that's seeing improvement or resolution, please just like reach out to anybody of like, can you help me write this case study and publish it, because it is a novel finding. That is what case studies are for. And if we have case studies in case series, then you can use that as a justification to do a pilot trial on it.
Research.
To do research. So we need the case studies and case series first. and then we can start doing research on it. Not always, but it does make it easier because we can say, oh, well, Mr. IRB or Mrs. IRB or whatever, this case series is something I want to follow up on. It looks like it might be something interesting. Here's all these other things talking about ketogenic diets being safe. Let's do a study on it. And it just is, it's a process that can make getting the research done easier. And even if not, like there's a case series talking about carnivore diets for SIBO, bacterial overgrowth. So that's something novel and interesting. Like anything novel and interesting, just publish it. Like anything. And
I know that
Low Carb San Diego, they were talking about this. Just publishing.
Anthony Chafee has seen multiple people, this is his testimony, that he's seen multiple regression of plaques and in the brain, or lesions in the brain for MS.
Oh, for MS, yeah.
Yeah, that is super huge. Because MS is like progressive, and there's no cure, and the drugs are really bad. And here you've got people that are using a carnivore diet because I guess they prescribe a pretty strict diet. Like they're seeing the lesions reverse, which it means neurological function is returning and is repairing. And that's amazing.
Yeah. And maybe those publications are already like in process, because I also know it takes like a billion years to publish anything, having been through the process.
Didn't you do one?
Yeah, I've I'm up to 2 papers at this point. And it does take a while. It takes a while to write, it takes a while to put together, it takes a while to figure out everybody you want to be on the paper and work on it together and figure out what you want to say. Can take a while.
Was yours reviewed by Dr. Westman? Hearns?
I don't remember. Usually like there are other people on the team who know how to handle publishing. So I do my work and then it just disappears. And then all of a sudden it's published. Yay! I'm very spoiled. I will admit
you are, but that's great. No, that's great.
Yeah. But yeah, I think more publishing is good if it's a genuinely novel finding, and if you have the data, just publish it. If you don't have the resources to publish it, reach out to Nick, to anybody who's published previously, and see if they can help you put something together and publish it. Because like the more stuff that we have published on a ketogenic diet, the more we can move forward. Because that's what we've seen is when Type 1 Grit published their data, all of a sudden it was undeniable. Like it still took a while for things to change, and they're still changing, but it became much harder to deny the use of a ketogenic diet in that circumstance because they had the data. And Dave is doing the same thing with lean mass hyperresponders with his study, and he's published like 5 or 6 papers at this point. And same thing with type 2 diabetes and Virta. Like there's so much stuff where like publishing it, like blog posts are wonderful. However, like if you want something to exist in perpetuity, then publishing it is the way to go, because we've seen this over and over and over again where somebody publishes something and it disappears off the face of the earth until like 80 years later, somebody who's digging through some filing cabinet somewhere picks it up and goes, oh, that's interesting. And then all of a sudden things change. We saw it with hand washing. We've seen it with all sorts of stuff and changes of care. Like things take a long time, so we need to house the information where it's not going to go anywhere.
That is true. Evidence-based practice is huge in the nursing world, and it's huge in all of medical, and it takes 17 years from the time it is discovered, or like, oh my gosh, washing hands works. Yeah, imagine that. It takes 17 years from that evidence-based practice to actually be put into practice. And by the time many of these things come out, there's something that's already debunked it. That we saw that with like oh my gosh, when I was going through nursing school, it was scrub the hub when you're doing IV push medication, scrub the hub. And then by the time that I was hired on in med surge, which was just like a 4-year difference. Now it was, you had to do it for 60 seconds. Like sit there for 60 seconds. You had to sit there and do it. And then all of a sudden, nope. It was like new papers were coming out and they were like, which one do we use?
Yeah. And that's the other like side of it, is that like there's this quote where it's like, by the time you like graduate medical school or something, half of what you learned is outdated and incorrect. And you just don't know what half.
Yeah.
Like I understand why things take a while to implement, but they're never going to get implemented if they're, I mean, not necessarily true. It will probably take much longer for it to become standard of care if they're not in the published literature.
Do you think that they're not publishing? Well, do you think that people aren't publishing because of the stigma around it? I mean, you see all these people, like you see something great, like Harvard put out their carnivore study synopsis when these people did their little report, and it was like, carnivore diet is amazing. And then what was it, 2 years late? No, that was 2021, I believe. So this 3 years later, Harvard's like, it is the worst diet on the face of the planet. And it's like, you completely flip-flopped like in 3 years. So it's like, is it because do you, and I'm not trying to get political, but do you think that there's a push to keep people from?
I mean, maybe. It might be difficult to publish case series and case studies on ketogenic and carnivorous diets because it does have to go through a review process. So you have to know where to publish and, you know, which peer reviewers you hope to get and stuff like that. That might be a component of it. I've not really thought about it. Another component might be having your name on that type of paper may put a target on your back, because we've already seen doctors facing a lot of stigma for even recommending ketogenic diet. So there may be doctors who just want to operate under the radar and don't want any attention on them. And even though they have these amazing case series or like examples of things changing that they never thought possible, they just don't want to be put in that position where they might lose their license because they have a family, they have bills to pay, like they have gas to buy, like all this stuff. So that might be another component. But then another thing that I do see mentioned quite a bit is that they don't have time and they don't have the staff to do it. Because like I said, it takes a lot of time and resources. And these are people who are often working 12 to 14-hour days. Like they're lucky if it's 9 to 5. And if it is a 9 to 5, they might not want to dedicate the extra hour a day to put out a publication that they know they're going to get flack for, and they know, you know, they're going to get criticized for and all this stuff. So I think it's just difficult on multiple fronts. So I guess I shouldn't be the one sitting on my pedestal saying, well, you need to publish, because it is complicated.
But somebody's got to say it. And I think that you're the perfect person to say it. I love what Amy says here. Oh, wrong one. That one. Because her children's book, she wants to make a difference and tell children that when they are young, that we are proof that my mom said no fat when I was young, and now it's hard to accept eating fat. So, you know.
Yeah.
So, trying to start with the young ends.
Yeah, and that's the thing, like, that is a lot of what I like to focus on, is not like, what's wrong with the world? Because I could go on forever about that, because there's a lot of things wrong with the world, in my opinion.
Amen. Amen,
but
sister.
Focusing on like, well, what can I do about it? Instead of, because like this is a cycle that I get in with lipedema as well, is getting really angry, getting really frustrated, going through a level of grief about like where my body is at, how it's impacting my life, the possible impact in the future. Like I don't talk a lot about the psychological aspect, because who wants to talk about that? It sucks. But like, I'll get really angry and I'll get really sad. And sometimes I'll cry about it and sit in my room and pout, like, why me? Why anybody? Why does this exist? And then, you know, after a second or two, I'll just be sitting there and it's like, well, what are you going to do about it? Like, like, this is your situation. This is your life. You could be in a lot worse situation. So what are you going to do with the opportunities that you have? Even if you have to deal with something sucky, Like your life before sucked. You were depressed and you didn't feel good and you didn't have a lot of energy and you dealt with insomnia, and look at what you did with that hand. So why is this going to be any different? Because people don't know a lot about it. Sure, people don't know a lot about a lot of things. It doesn't mean you can't do something about it. It just means you have to experiment and think about it and not necessarily rely on other people to give you all the answers. But that's life. Right. Like in the future, when I become a parent, that's also something I'm going to deal with. Nobody knows how to be a perfect parent. Literally nobody. If they say they do, they're lying to you.
They are
so
totally
you have
lying.
to
they
experiment.
Are lying so much. We're
so
like
parenting,
we feel like we're decent parents. We feel like we are above average. And
your
we
kids
still
are alive.
Suck at it.
Your kids are alive. Like
they're
mom
seniors.
Would say,
oh my gosh,
my mom would say, like, me and your dad, we got you to 18. You're alive. We did it. Success.
Woo!
Like the fact that she likes all of her kids and that all of her kids are doing pretty well, that's icing on the cake or butter on the steak, whatever you want to call it. But like this isn't any yeah, that's butter on the steak. But this isn't any different. Like, oh, I have to deal with something difficult. Like, welcome to life, kiddo. Like, what are you going to do about it? And what I've been doing about it is researching and learning about it and figuring out different things to experiment with and how can I help myself
telling people
and how can I help other people? Because whenever I'm like down in the dumps, I start thinking about, well, if you're experiencing this, think about all the other people who are much worse off in dealing with this. What can you do to help them? Because you've learned a lot. How can you help them learn? And how can you put it in a way where they're not dealing with despair, where they feel a level of hope, where they understand that there's people on their side who care about them and love them, even if they don't know them. Like, I don't know most people in the lipedema community, but they hold a place in my heart because they're so hardworking. They're so strong-willed. They're so curious. They are so smart and just looking for any way to deal with this. And so when I feel sucky, I think about them and it's like, well, stand back up, get back to work, and
put on
like,
your
you got stuff
panties.
to do. Yeah, put on your big girl pants. You got stuff to do. And
well, you know, I think that something, not that you left out, but that I think is important to you in this community, especially, is like I started a YouTube channel.
Mm-hmm.
Why? Because I raised my family. Even my husband now is on, like, we're all on a proper human diet, as Dr. Berry calls it, and we're all on a different spectrum of that diet. I'm the strictest, you know, but it's like I started telling people about it.
Mm-hmm.
And then I got into a community and told people about it. And then when people ask me, like, well, you look great. Like, the inflammation in your face is down. Like, you look less swollen. Like, you look fantastic. What are you doing? Like, now I get to educate somebody and share and hopefully change a perspective, because it's about planting a seed, changing a perspective, and then hopefully changing a life. It's not like I'm not going to go out and be a proselytizer on the street corner that's all of a sudden going to convert all the sad diet people to a carnivore way of eating. That's not how this works.
Yeah.
You know, but you give them something. They see you. You are the, example.
Mm-hmm.
And then you tell them, and then you tell the world. And then we just start this big chain. And that's, what a lot of us are doing. You're doing it through research, which I absolutely love because I'm a nerd, but I'm not nearly as smart as you. Not nearly.
Well, Ken Berry has talked about this during some of his presentations, where he talks about, like, everybody has something that they can do. Sometimes it's doing research. Sometimes it's as a doctor. Sometimes it's as a nurse or as a nutritionist. Sometimes it's starting a YouTube channel. Sometimes it is just being an example for other people and being kind and being non-judgmental and being welcoming and being open to providing resources if people are interested, and not being pushy and not insulting other people, and just being overall a class act, so that they can see, oh, maybe this is a community that I want to engage in. even if they may be starting off in a position where they do feel hostile, they feel like it's total zealotry, they feel like it's a bunch of woo-woo nonsense, that's fine.
Mm-hmm.
But if we can remain in a place where we are kind and civil and understanding and empathetic, and we just say,
Yes.
okay, that's where you're coming from, that's fine, I'm not going to push anything on you, I'm just saying this is what worked for me, yada, yada. Eventually, those people can circle around if they need the help and if they're open to it, and it can really change their life. Like, I have known people where they used to be no keto for me, no carnivore for me, blah, blah, blah. Like, prior plant-based dieters and stuff who changed their mind and decided it is something they wanted to explore. And some people never changed their mind. And both of them are perfectly fine. But the whole point is to show people who may not be aware what's possible, and to be welcoming for them if they do decide, no matter, you know, their gender, race, creed, politics, whatever, because it's about health at the center, and the rest of it does not matter, because I want
exactly
a healthy country. I want healthy neighbors. I want healthy family. I want a healthy husband, healthy children, all of that. I don't care about any of their other opinions. My only question is, are you healthy? If not, do you want to be? If so, can I help?
Yeah. Well, you know, yeah. I don't know if you saw, I don't know if you scrolled through any of my videos. I know that you saw the one with my daughter, but I did one with Philip Meese and my husband.
Oh, yeah, yeah.
And there was a general, and I think even, who was it? Dr. Volek, maybe? Might have put out an opinion piece about it, about how people are unfit to serve. People, they're too fat to serve the current level of recruits. And my husband started seeing this when he was a recruiter. Like, now we don't even have an army that's fit to fight.
Yeah.
You know, like, my son was like, he's autistic too. And he's like, I have to register for the draft. I'm like, yes, when you're 18, you have to register for the draft. And he's like, I was like, you'll probably get disqualified. You know, you're autistic. He's like, well, maybe I shouldn't be disqualified. I'm like one of the only people that can fight. And I'm like, oh boy. Like, but the quality of our recruits are, like, they are going down in the general population. You have more and more teenagers having type 2 diabetes, and they get disqualified.
It doesn't just impact the military, it impacts everything. Like, even if you have an office job, if you're not healthy, that's going to mean more sick days, less efficiency, less productiveness, and just less quality of life. And I don't like that. Like, I want people to be happy and healthy.
Well, you know, and now I'm not going to ask you your religion or your beliefs, because that's my business. But I'm a Christian. I go to church, and most of the prayer requests are about health related issues, right? And I'm like, one of our goals is the Great Commission. We're supposed to go out and tell about Jesus. Well, how can you do that if you are sick and immobile and on a breathing machine, or on oxygen, or, you know, you pass out a lot from your diabetes, or, you know, like, how do you do that? Like, it impacts absolutely everything.
Yeah. Like, and this is what we talk about at the Lipedema Project too, because like, there are a lot of people with lipedema who struggle with mobility, or who are in wheelchairs or bedbound. They may be in extreme levels of pain. They may be struggling with the emotional and psychological aspects of it. They may have trouble socializing because of the disease, all sorts of things. And
lots of stigma, because they're just obese. You're just an obese person that sits around eating ho-hos, and you're like,
and even if that were true, even if someone is just obese, it does not excuse that behavior from other people, because it's a disease. It is a consequence of a metabolic disorder. But in any case, so with lipedema, and then they get into the community and they start seeing like all these different things that they can do. They can do low carb or ketogenic or carnivorous diets. They can do compression. They can do lymphatic therapy. They can do pool exercises. They can do, like, the list of things is enormous. And we have to almost like walk them back and work with them and talk them through. Like, okay, the goal of this is not for you to need to spend 12 hours a day managing your condition. Like, the goal is not to live so that you can manage your lipedema. It is so that you can manage your lipedema so that you can live your life. And that is true of like everything, because not feeling well and being sick and being depressed or anxious or whatever, it necessarily impacts your life. And that's going to impact any goal that you have, whether it's writing books or creating art or being a doctor or being a nurse or being in the military or traveling all over the world, whatever it is. So
it's all of
like
it. Yeah.
for me, like a healthier world is a happier world. And a happier world is a place with more art and more books and like just people being able to do what they want to do. And that's what I want for other people. And it's why I spend so much time on this stuff because I've seen people in the community like just change their lives and flourish, and not just in the lipedema community, but also in the low carb community, in the carnivore community, in the health community in general, change their lives and flourish. And they're suddenly, you know, writing books, or they're getting into their hobbies, they're learning new languages, they're just happier. And even the doctors who get into low carb and holistic approaches are happier. They're less burnt out. They feel more effective. They feel like they have a positive influence over the world. They don't want to quit their job anymore. They're happy to go into work and see their patients. And their patients are happy to see them because their doctor does good work. Like, it goes in so many directions.
Goals. Yeah. Those are my life goals. Those are my life goals, is that I'll get my nurse practitioner and then hopefully get into the low carb space and be one of the low carb providers that's out there that people can come to, where I love my job.
Yeah. Like, I just love it when people are happy and doing what they love and are feeling good and hopeful and optimistic for the future. Because I think like the struggles of the world, at least in my case, like imagining the future of the world and the country and my state and my town and my family and like myself gets a lot easier when my brain is healthy. And I just think like, instead of being like total doom and gloom, it's like, all of these problems we have are so fixable. How exciting is that?
Well, I have a question for you. Like, so you said that you struggled a lot with mental, like with depression and stuff. Did you find that being on like a ketogenic diet, that your negative thinking maybe was easier to combat?
Oh,
I mean, because negative thinking is definitely a process to combat, but so, was it easier?
Yes. So here's an interesting aspect that I think is worth talking about. So for one, the depression symptoms went into remission within 2 months. So that's a big deal. But left over from that, there were things that didn't resolve or that I still had to work on through other means. So for example, I had social anxiety afterwards and I had to work through that. But I think the social anxiety was mostly habit-based from the thought patterns that were coming from depression and the expectations from the depression. Because with the depression, every single social interaction, I would go over and over again in my head. I would ruminate on it, and like phantasms would explode out of like, they didn't like you, they thought you were annoying, that was dumb, you were dumb, like that,
almost,
blah, 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 blah.
Almost, I hate this word, but almost catastrophizing.
Yes, exactly that. Word. Every single interaction was like that. And it impacted my relationship with my now husband, impacted relationships with family, impacted my relationship with myself. So a lot of that, after going on a ketogenic diet where the depression symptoms were in remission, I still needed to work through that. And but it was so much easier. Like, that's what I was doing at Keto Fest, is I was suddenly able to go up to people and talk to them and ask them questions of like Dave and Amber and Ivor Cummins, like all these different people, just go up to them like speakers at this event that I was staff on, and I was participating as staff, and it was fun. And all of a sudden I found like when I had those new interactions, my brain was putting together these new patterns of that was fine actually.
Like a rewiring.
They had fun. Yeah. So there was a level of practice needed for that. And partially I was using Dave for that because he's really good practice if you want to get really, really good positive reinforcement on your interactions with people. And then some things I did need additional tools for. And what was interesting is that when I went carnivore, I found that there were a lot of memories and trauma-related stuff that was coming up that was really upsetting, but I could then handle it. And before keto, before carnivore, I wouldn't even think about it because I just could not handle it. And ultimately with that, I ended up getting trauma counseling for it, which was super fantastic. But I needed that extra tool to deal with it. But I think if I hadn't been on a ketogenic diet, I mean, I know I wouldn't have been able to handle it because I didn't. Like, I sat on stuff for like decades. Like, yeah, no, I'm not dealing with that. I don't have like the mental bandwidth for it. Like, it's going to turn out terribly anyway. It's a whole thing. So, like, going with what you're talking about, when I am best on my diet, like I have my fats up, carbs down, super, super low, not on dairy, like not eating anything that bothers me, getting plenty of meat in. I have this level of like zen and optimism and confidence that things are going to be fine. Even
like joy, almost like joy.
But also like I may not even be like enjoying the moment of like it's really difficult, it's really stressful. Like one of the projects that I'm working on right now is the Lipedema Project is putting out a book. It's public knowledge, free to talk about it, and I'm co-writing 2 of the chapters. That's a lot of work. I'm on a deadline. It's stressful. But I'm just approaching it like, it's going to be great. Like, sure, you're in this part of the phase where I'm like, oh my God, this whole thing is garbage and it's never going to work out. But then another piece of my brain is like, this is part of the creative process. Isn't this wonderful? You're in this space right now, and you always move past this part with any presentation, with any writing, anything you ever do. And this is just your brain looking at things on the paper and being like, this isn't right. And I know there's something not right about it. And you'll figure it out. So even in like the frustration and the difficulty and the difficult conversations and like all of this stuff, there's just a positivity and just a steady foundation that wasn't there before. And I think it makes me much more pleasant of a person. Like, I'm definitely not perfect. There are plenty of situations where I apologize to my husband because I was like being annoyed with him or like sniping at him or whatever. It's like, oh, I'm sorry, blah, 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 blah. So I'm not perfect or like a superhuman or anything like that, but it's just easier. Like, my brain is so much happier and it's willing to take on extra things and extra difficulty and just like the day-to-day of life. And it just knows that it can handle it, if that makes sense. And I think that's much harder to do when it's not working at 100%. So I don't know. I think there's like a level of healthy brains or happy brains. And I've definitely seen it in the low carb community too. When someone's really, really healthy, they're just like happier.
Yeah, you do see that. You do see that a lot more. So we've gone an hour and 43 minutes. Like, yeah, no, I could continue talking. My husband actually just walked in the door. He was expecting.
It's like, you're still talking? What are you doing?
Yeah, you're still talking. Oh my gosh. No, so my biggest thing right now is, do you have any upcoming events that you'll be at where people can come and say hi?
Yes. So I will be at COSI next year. That is in February, and I believe it is the 8th and the 9th.
Is that in Las Vegas again?
Yes, it's in Las Vegas again.
Okay.
Hopefully not in a casino this time. I don't like casinos very much. But yeah, I'll be at COSI.
But that's for a whole other reasons. That's for sorority reasons back in the early 2000s.
But COSI was wonderful. and I will go every single year. It is available, so you'll always be able to find me there. And then this September, actually, for an online event, Lipedema Simplified is hosting our fall symposium, event, conference, whatever you want to call it. And we're focused on the holistic approach to lipedema care. So that's talking about not only the physical things that you can do, but also the mental, the psychological, the social, the spiritual, all of that good stuff. And like I said, it can be really, really overwhelming if you're suddenly coming into a space, or you've been in like a crisis point where you kind of have to reevaluate, or even just like stuck in a rut can happen sometimes. And a big focus is just kind of helping people figure out just what their next step is and really focusing in on that. So I'll be there and participating in the chat, and I always like the events because they help me refocus also, because sometimes I get stuck in ruts and I have to reevaluate. So yeah, those two are my next upcoming. And then, like I said, the Lipedema Project is working on a book. So once that's out, I'll be promoting it everywhere.
Do you have channels you want people to go follow? I follow you on Instagram. It's mostly your knitting, which
I haven't posted an Instagram in like years.
Forever. You know what? I just want to tell like a real quick story before we head out of how I met Siobhan online.
Yeah.
It's so interesting because I've been following her because, you know, her and Dave are super smart and I love seeing what they post. And she's always posting this beautiful knitting. She is very talented at knitting. And I was like, my daughter would love those socks. Oh my gosh. And Siobhan was like, I think I might have extra yarn, enough for a pair of socks. And I was like, oh, really? And that's how we started talking. Yeah. It's about a pair of socks, and they are pretty, and they are coming eventually. And whenever you're done, there is never her feet are not going to continue to grow more. I hope not.
Well, that's good
because
yes,
her height to feet ratio is already disproportionate. Yes, so
I do need her measurements so I can get started on those. By the way, I am finishing off a pair
I've been making some notes. Measure Audrey's feet.
Yeah, and then I can get started on those as soon as I have those. I'm finishing off a pair of mittens for my mom, but I should have those done within the week, and then I want to knit those socks. Yeah, and
that'll be great. So what we can do, what we can do is, Siobhan, after this, stick around. And you can give me a list of things to put in the description for afterwards. There'll be links because I want the link to the Lipedema Simplified, link to Co-Science, link to everything that you want linked. And so that'll be in the description, afterwards.
Yeah. And the place where I am most active is on Twitter. So it's just under my name, but we'll have that linked as well. But I haven't been posting as much on Facebook, but I'm usually active on Twitter. And I also post my knitting there in case you just want to follow for that reason.
Yeah, her knitting is great, people. If you haven't seen it, you really do have to go check it out because she's spectacular.
It's my meditation. It's knitting.
I can crochet some simple stuff, and it is meditation. There's something, it's rhythmic, and it's counting. And it doesn't allow your brain to think about all the emotions because you're counting.
Yeah. And sometimes I find, like, if I get in a really good groove, I actually will start processing the emotions of the day, but in a really calm manner, which I've heard meditation is supposed to be good for, but I don't actually meditate because it makes me angry. So I knit instead. You got to find what works for you. Yeah, you got to find what works for you.
Knit. Okay. All right. Thanks, everybody. I'm so glad that you guys stopped by. Don't forget to like, subscribe, and share. Thanks. See you guys later.
Bye.